My name is Rose Elliott. I go by Rose. On this slide, the first slide says Rosemary, and then I'm going to put it to the big slides here. But welcome. So, it was supposed to work. I don't know why. There we go. So, this session is virtual and in-person simulation-based learning in a nursing education. And I'm very pleased to be a part of this presentation for Faculty of the Future. I learn something each time. My technology skills have been upgraded, as in the past half hour or so, with Blue Jeans, but that's okay. It'll make it work. So, I want to invite you to, if you have any discussions, please unmute yourself. And right now, there's not a lot of background noise, so you can keep your microphones open. So, I found this dedication. This is very heartwarming, but it also speaks to nursing. So this dedication to this presentation is to the nurses around the world who paid the ultimate price of caring for people during COVID-19, the crisis of 2021. I think that continues today. Hundreds lost their lives, and many thousands became sick themselves. And those who escaped the physical symptoms of the illness did not necessarily escape the physical and mental toll of working long hours in grueling circumstances, and sometimes without the proper personal protective equipment, and we call it PPE as abbreviation. Their dedication and their persistence in the face of adversity saved countless lives. Now, in speaking as a nurse, I can really relate to this, but then there's also the place of, there's people in healthcare who aren't nurses, who were part of supporting nurses, doctors, respiratory therapists, the whole gamut of healthcare careers, who saved countless lives, who they themselves put themselves at risk. And I just want to give some dedication to those people.
Hey, Rose?
Yes?
We can't see, we're still seeing just the first slide.
Ay, sweet Lord. You still see on the first slide?
So yeah. My screen went gray.
You know why? Because I didn't do this.
Oh, there it is. Okay.
And you see it now?
Yeah. And we see you.
Oh, that's great.
That's
nice. Sorry, screen share. I'm supposed to do this. Yeah, my IT skills are a little bit on the slow rise. Is it okay now?
Could be.
Are you able to see the slide now?
The dedication slide, yes.
Okay. Thank you very much for telling me that. I appreciate it. I'll take all the help I can get. So, now, there we go. So our goals today, and welcome for those people who have joined us. And our goals today are discuss undergraduate nursing students' clinical in-person nursing simulation learning environment, abrupt change to virtual platform screen-based simulation. And then at the end, I'm going to compare the undergraduate nursing student simulation evaluations of two clinical learning environments. So this is a picture of our nursing students when I did the simulation, and it's called Disaster Preparedness and Management. We do this in the senior level, and as you see, nobody has a mask on. So definitely land before COVID. But you do see a gentleman with the mask there, which is interesting. Part of that simulation was at some point there's a quarantine. Never in our wildest dreams did I think that we would be quarantined. But that actually is foreshadowing for events to be unfolded. But you can see in the background here, you'll see the green area. So the students' goal in doing this is we do a pre-briefing. Then the students have categories that they have to, triage categories that are pre-hospital, red, yellow, green, and black. They have to assign those tags, like the paramedics do in a disaster, which is something separate from their clinical that they have in the hospital, where they have all their resources and they have other people to gather skills from and bring other help with. So, but basically the same concept is still the same. We've not been back to the gym because of our experience. We had to keep it not low-key, but we had to keep it confined, and that's okay. Anything to keep it safe, because a student should be in a safe environment. And now, basically, even though I'm speaking without a mask, the students, we are required when we're in class right now, especially with the increase of numbers of COVID, even though we're all vaccinated, we're required to wear a mask inside the building, not an N95 though. So also require the students for a 3-hour module. They go onto the FEMA website. Their name is actually in their certificate here, and it's the Emergency Management Institute of FEMA, and they learn the incident command structure. And they have to do that prior to coming in and print their certificate. So that's part of their student prep for the simulation. And for those who are not nurses or don't know of nursing simulation or healthcare simulation, it's a clinical experience that is mirrored with little cues, activities to replicate a real clinical experience. And that's just a real small version of what simulation is. So sim-based learning, and I know most of you should know this, especially if you're nurses, it has been common in the past 20 years that simulation is considered a clinical experience. So here it is. We're notified that all our, and back in 2020, we were notified everything is shut down. Our clinicals are shut down. The world globally was confined because we didn't have vaccinations at that time, but we still wanted to operate as a nursing school. So that was the big dilemma. So I had a big pit in my stomach for a long time. How can I get a very engaging activity and yet make it virtual? And how do I do that? How do I get the IT? How do I do those gamified activities? And I thought, where am I going to get this from? So what I did was, I'll just read, and I know you're reading some of the things that are on here. Our purpose as nurses educators, replace usual ways of clinical teaching to seek alternate, safe, clinical-based learning opportunities. And that's Dr. Kim Layton, and she's out of Massachusetts right now. Very well published in the International Association of Nurses and Clinical Simulation. Also, I was looking online, Society for Simulation and Healthcare, the weekly open forum digest. People were pouring out, what do you have? What can I use? And these were all free access. I have to say, I have no disclosures. I have no financial relationship with anyone I've gotten anything with, but everything I was able to get with our communication with nurses and healthcare simulationists around the world was free access. So I kept looking and looking, and I finally was able to find one, but based only on keep searching on the internet. The Canadian Alliance Nurse Educators Using Simulation, they develop, and they also, there's a webinar coming up at Developing Public Health Competencies, but there are competencies that we had before when we were in simulation. And also the American Association of Colleges of Nursing, and that digest. And here on this side here, you see this, so you can see I went to all these. That's the SSH, and that's an Axel. And then here, I was able to get these, and I kept sifting through it. I said, there's got to be something out there, and if not, I was going to have to start from the very bottom again. So here is a sample of communication, and this just popped up the other day on the digest. And this is how free and giving of their information that people had done, especially Colette Falsidal. She said, here's virtual simulation. It's called Creative Commons. It's free. Now, the only time they charge, and there are companies that do charge for a fee, don't have a problem with that, but it's not something that I was able to do. We were pretty much get involved with PPE and sending them to the clinical sites. We're talking like in excess of 40,000. And I'm still working off of someone. It's in the back of this room protected. So we had to give people PPE going to hospital because there was a scarcity. Because we all know where the starts were, no political comment about where it was started. In China, we get a lot of our PPE from China. So there was such a scarcity. I was just like, how are we going to send them there? We don't get it. So it took a while. But anyway, back to this again. So I was looking for free. So the NLN put this together, and you see the sidebar here, over here, you can see that. These are all virtual simulations. Some are free. Some people put it out there because everybody was desperate in 2020 for some virtual simulation. that they could put up right away. And something was ethical and something that matched your curriculum. So there were all these links, and I didn't go all the way down, but as you see with this, it's 9 pages. Is that 9? Yeah, 9. I also have one that's 15 pages too. But Ryerson University and a lot of them from Canada, they were able to give free access, but not everybody was. But that's okay, because free is only free for a certain amount of time. So this is where I found the golden nugget, the golden ticket, like, and Polar Express. That's what I felt like I had, the golden ticket, because when I went on this site, which is part of Simulation Canada, you did not have to have membership. However, I joined so I could have access to other virtual simulations. Because if you look at it, all the backgrounds and all the education and resources were very extensive. So this is just a photo picture of what the screen looks like. But if you go down, the actual simulation for emergency preparedness was here, and I was just so grateful to get this. And it still is in operation today. So all these hyperlinks, they'll tell you all these virtual healthcare experiences that they could build in. So whatever clinicals that were not able to be supported during the restrictions with COVID, and we know now, last year, we have been able to send everybody to clinical, and that social distancing was relaxed, but we still go in with our procedure mask. You have these virtual experiences that are able to mirror your clinical experience. Now in Pennsylvania, I don't know where everybody is teaching or what university associated with. We're on 50-50. 50 can be simulation, 50% of your clinical time can be simulation, and 50% needs to be face-to-face. Now, I don't know about you, but our seniors, we wanted to make sure that they were going to clinicals that allowed nursing students, because the obvious thing was there was very limited spots. So our juniors ended up having virtual simulations. And here it is. This is the prize. To me, it was the prize. Again, this is a picture, so none of these are active. But after I'm done here, you're welcome to go through them and just put turbulent sky 360-degree disaster management simulation. Overview gives you an overview of all the different topics, all the different roles, responsibilities of simulation, the theory in the background, the quiz, and then the quiz in this area here. When you pulled out the drop-down menu, I was able to operate this with myself and someone else. We practiced the timing, but I have to tell you, we were scared when we were doing it. And I mean scared because we wanted a quality product, but we didn't know how it was going to, be. So we had everything scaled down to 15 minutes, 20 minutes. So like I said, this was prepared by a professional TV station in Canada. And it's, like I said, it still acts like it's part of a game. It also has things embedded in here of YouTube segments. Again, fascinating product, and I was, again, kissed the ground, grateful I found it. So this is how we set up our agenda for Turbulent Sky, and this is straight virtual when we started it. So then, like I said, the nursing students had that preparation, the 3-hour. It's a module, it's still there, and that is free. The students just have to sign on with the FEMA number. I tell them that the government does not track them, that they will not sign them up for volunteer time. But again, it's something they can put on their resume when they go for jobs as a senior. Our pre-briefing, we went through the goals of what emergency preparedness was, what were disaster phases, and what were the objectives. And that was based off of CUSIN, Quality and Safety in Education and Nursing. So, and I do have that handout. I didn't want to interject it in here because I don't want to lose you as a audience. But I do have it. If you want it at the very end, I can send it to you. It's, like I said, fantastic. There's no wonder of how to run the simulation. We gave the overview again of what the public nurse's role is and disaster management phases. There's a segment on there where the Red River College School of Nursing faculty, two of them, they actually presented at a conference, and I let that as being part of setting up what they did for a perfect storm and in Manitoba. And yes, they talk about Canada, but disaster preparedness is around the world. It's global. It's just not about Canada. But they did talk about September 11 for us as a mile marker. And that was fascinating. And that's only 20 minutes. I made sure each activity wasn't overburdened where students are just like staring at us. We wanted to have some interactivity. So we had the nursing students with their clinical instructor to review and discuss Turbulent Sky Quiz Challenge as a clinical. So they reviewed that, and then and that took about 20 minutes, I guess 30 minutes, and then they came back to us, meaning speakers, myself and or one of our instructors or sim instructors, and then we did this actual turbulent sky scenario. You click on it at the middle, remember seeing that before that thing, it says turbulent sky, and you see like an airplane kind of coming down, and you don't hear a crash, and then you see the hundreds of people coming in that are casualties. Sorry. Allergies this time of year. So then there's a part in there that they have an EMS or EMT actually doing the triaging. So we have the students act as if you're going to the person to triage them. And I say, tell us which color it is. And it's built into this. So the paramedic gave you real-time 15-second. They had 4 clients, so there are 4 settings. They had to decide, is the patient tagged as red, yellow, green, or black? So they did that. That was their engagement. And then they came back to us, and then we debriefed. We had a debriefing statement from each of the students, at least 3, even if it was the same thing. So we did have engagement. We also had a part of moral distress, and I just got this article off of Nurseology blog. I don't know if anybody sees it. I just get fantastic nursing input into this. Dr. Pierre, 2021, talked about lineage's theory, a cultural care theory, and actually talked about almost about the same thing that the initial speaker we had today, about transcultural. If you're in Canada, you're talking about Canadian citizens, but you could have had somebody from the United States or from another part of the world. So we talked about a Canadian border control or security. We also talked about what would happen in the United States when there's an airplane accident, because it could have been a terrorist event. But the moral distress we really focus in on is like, what's it like in the hospital if there's a rapid response? We have all the materials there. But in this part, you're tagging somebody and you're waiting for everybody else to come. You're the first ones on the scene. So that is morally distressing, because you know you're going to walk away from someone. You're not going to do compressions on somebody's tag back. You just put a tag on them and you move on. And that's something different when we talk about doing compressions and when you find somebody who's unconscious. Because in this setting, you have to look for the most to survive. And I'm just looking at my time here. I don't want to be too long. But I wanted to explain that this was really a 3-hour, really engaging event that I didn't think was going to happen. And I was worried about the evaluations. How are the students going to perceive it? So here it is here. So here's kind of like, looks like a little game in a way, but it's not. So right here is the triage where all the casualties came through. And that's the people behind here, kind of grayed out. And then they were sorted into the yellow, green, and over here was red. And I didn't see actually an area for morgue. And usually that's what happens in any disaster. There's a refrigerated area for the people who are deceased. This was a psychological safety. And again, this is to ship out at least 8 to 9 people to the hospital, as opposed to 1 or 2 you can put in back of an EMS truck. So they got to learn about EMS services also, but they actually got to see what it was like, and nursing students rather, acted like real RNs. That was their role. They did secondary assessments. So once they were tagged, they could come into here to treat some of their symptoms, like giving them a nebulizer, things of that sort. But I let them know, none of this happens right away. It takes hours and a full day to get all this equipment here, even to get these tents up. You just might have something flat on the ground and you're moving people to this area. So you see there's a little book off to the side here you could also get for resources. So this is, again, this is not an interactive map as it is right here. To me, it's just a picture off of the computer to give you an idea. So here were evaluations. In the spring 2021, because in the spring of 2020, everything went virtual and some were canceled. So pre-briefing, our number was 78. And then what happened was we had 11 somewhat agreed about what increased their confidence post simulation, a scenario. What was their ability to prioritize care? 61 strongly agreed, 17 somewhat agreed, 0 did not agree. I really thought a lot of these numbers were going to be a lot higher. Okay? And right here, debriefing improves clinical judgment, because that's really what we're looking for, no matter we have virtual or we have face-to-face. What improves their clinical judgment? How are they putting this together? So 65 said strongly agree, 13 somewhat agree, and 0 did not agree. So that was 2021. Again, I was nervous looking at these numbers, wondering what happened with the students and how did they perceive the simulation. So coming up to this spring, 2022, because I've run it a few times after this, our numbers were 84, and these are senior level students. The pre-briefing, the same thing, increased in confidence, 74. So if you look, the numbers almost were the same, just based on the amount. And then the scenario, ability to prioritize care, 67. 15 says, I'm not sure, because students really felt uncomfortable with doing the categories because it was a new skill. But that's okay if they don't agree, because it has to be a psychological safe space. If we're giving them new content, they've never done it before, they are going to be a little nervous. So their confidence level might be a little different. Are they really going to be able to prioritize care? Well, like I said, this is pre-hospital. This is something, we don't have EMS, paramedic training. We're training these to be generalists, RNs, when they graduate. So, and the debriefing, did this improve my clinical judgment? 70 said strongly agree, 12 said somewhat agree, and 2 did not agree. And I don't mind that they don't agree, because not everybody's going to agree with whatever content you put in front of them, whatever simulation you do. It's more about, I was surprised the numbers were that high and strongly agree in these 3 areas, to be quite honest. And now you're back. I'm just going to ask you, are you surprised about these evaluations? I'm just curious. Yeah. I was personally, because I thought it was a brand new thing. I've never done virtual before. It was brand new for them, and how can I be engaging when you're virtual? Because of the lack of the ability to do in-face, in-person clinical. So I was pretty impressed with it, and I'm glad it supported it. The anecdotal data I didn't put it on here because I didn't want to, because again, this is raw data, so I did not crunch these numbers as far as like statistically significant, ANOVA and all those other statistical information. But I do plan in the future to look at their anecdotal, their qualitative information and see what they said, and then make a more, robust research. So the conclusion is virtual and in-person simulation-based learning environments can be successfully integrated into undergraduate nursing programs. Now, this is an urban school. It is in Northeast Philadelphia. So you have to look at the context of your student, your learning, your demographics of your population too. I'm not saying it would be different in any other part of Philadelphia or a non-urban area, but I just want to let you know. So it is really only our experience. So I've not done this to replicate it in other, other universities. The rapid adoption of virtual simulation-based learning and education conditions and the global restrictive environment caused by COVID-19 can lead simulation-based learning in future innovations of distance simulation. And that's a French, I think it's either French or Spanish. And that's just, these articles are just coming out now, 2022, 2021. Just look at what we did worldwide for virtual simulations. And then this Professor Watts, it's out of Anaxel. She said that, and along with other groups, because there's a lot of people with this for the standards of design for simulation and practice. They've had these standards out for a long time. In fact, I have posters in front of the different doors than simulation. Simulation-based experiences are purposefully designed to meet identified objectives and optimize the achievement of expected outcomes, and that's by the NACSL Standards Committee. So I was glad that we were able to realize some of those, because that was my biggest thing. I wanted to have a purposeful clinical experience, but again, with the social distancing and the physical ability, we're not able to go into the schools and our other communities where we had the public health, because this happens during the public health tract in 442. So future implications, next steps. And this is by Dr. Kim Layton. Simulation and technology adoption is anticipated to change education permanently. Simulation-based education will be changed as well. Ensure education of providers to continue safe care for patients during the global pandemic. So it's not just for safe care for patients, it was really safety for nursing students too, to engage with meaningful clinical environments without themselves becoming potentially impacted by COVID. And that was before we had the immunizations. So there's also immersive virtual reality. Again, I have no interest, and I have no disclosures or conflicts of interest. I just put up what I thought was helpful for me in this endeavor here today. Questions and thoughts. So I kind of ran through that because I wanted to make sure I got my time. So any questions you would have? You can unmute yourself if you're not already. Any questions you can think of?
So will you bring something like this into a lower level simulation, or are you only looking for the senior students to do something not on this magnitude, but
we talk about content? Well, content, because it was content specific to that senior level. However, I think if I was, and we do have an increase in IT funding because of the virtual platform that we just kind of like have to put it together, consistently meeting the goals so these students can graduate and sit for boards. I think we could do it on definitely I think we can do it on the pre-license, well, they're all pre-licensure anyway, undergraduates, but you definitely can do it in 204 and the fundamentals. In fact, that whole list, if you send me, I can send it to you, because this is for emergency preparedness. I don't think it's a problem to put it into 204, but I don't know if the concept they will get, because they don't understand about assessment yet and what do those categories mean. But there are a lot of simulations that are accessible through the virtual format, and I have it here to put it in, but I was afraid of losing the format that I can send to you that are free. Some of them do cost money. Some of them are rolling back now because the students are now in school. So now they know, like, there's different companies. Sentinel U is one of them. And there's more than just one, though, that are willing to do it, but there's a fee per student per semester. But I do still have an abundance of virtual simulations that you're able to get and use for 204. I definitely think you could still use it. I think the hybrid's kind of cool. We also, just to let you know, I brought Moulage in. So I actually had them Moulage themselves up. And it was interesting. When they were doing it, they were all giddy and happy. And I'm thinking, well, the Moulage thing is kind of exciting, putting those fake injuries on, but I'm thinking, an evisceration's not fun. I'm thinking, how can you be smiling and you got an evisceration? Your intestines are sitting on your abdomen. So I had a trauma. So I don't make any judgment. I just say, but what they do is they just lay back, because then they don't have to interact with anyone. It's saying, you're not dead and somebody still can assess you. So it's keeping them interacted. So yes, you could take some of this virtual simulation and make it a 204, but you have to have them prepped in what they're looking for. So they have to have all their assessments kind of lined up, like heart, lung, blood pressure. But you could do a scaled down version, because if you're doing like the 15-second assessment, if they don't have a pulse, they're black tagged. You don't take a blood pressure on that person. You're moving on. So you can do that, but the instructor that I work with already does the lecture the week before. So I'm not saying you can't do it in 204, because that'll get them all excited, because it is very interactive. But again, I do both now. I do part of the virtual format, because it's that game board is fascinating, where you click on different ones. But I didn't want to do it on Blue Jeans, because I don't know it was going to bump me out. But I can send you, if you send me your email. Well, I can give you my email. It's not a big deal. It's RELLIOTT@holyfamily.edu. I can send you all the documents to support this. And you can take any piece of it and make it your own. But again, this is open access, and it does have QC competencies. But I think the competencies really kind of lend to a junior or senior level, but you can break it down. I think you can break any simulation, make it simple to complex. But I really think it's a senior level one, because it meets those objectives for emergency preparedness on the senior level. I definitely think you can break it down and make it whatever you need to. I just needed a packaged product that I could get out and be ready to submit that was entertaining, but still spoke to the goals of the objectives of the syllabus.
Right.
Because the syllabus are marching orders,
Right. Okay, thank you.
No, that's all right. And I can send you that. No, I didn't. Like I said, I showed you on the screen a small version. I do have a 17-page version that you can go through, and literally you go through it, you go, I can use that, I can use that. There's records, there's documents in Excel, Word. Again, not password protected, a lot of them. I did join SSH and the Canadian group, so I would have full access, but I really didn't have to join, but I was nervous. I'm like, I need everything right now. So, but yeah, they give you a lot, and you can spend a whole day clicking those blue hyperlinks, and you're like, this is really deep here. So it's interesting to do. But again, I make it hybrid now. I don't change it. I use Turbulent Sky. We actually, believe it or not, are on the flight plan close to Northeast Airport. And I said, I'm not wishing anything to happen, but if you do windshield survey, we're near train tracks. We're an urban area. Anything more than 5 people is considered a disaster. So, you can see whatever you want to do. But I found that Turbulent Sky to be very much real faced. And when you open it up and go, you just do a search and put Turbulent Sky simulation, and you'll go through it and you click on it and you'll go, this is fantastic. It's got like movies, but it's actually real-time TV. So you feel like you're like Channel 10 or 6 or whatever, just like going to see what happens. So anything else? I'm sorry, because you can get real deep on this, and I didn't know how much people wanted to go. Since it's recorded, next part, I want to thank you for your attendance and your participation. And here are the references. There's a lot of them. But I did use them, and that was part of it. And again, I was grateful to find it in a small amount of time. So, a little too much for a half-hour presentation? Not sure. Yeah, it depends what your needs are. But if you send me your email and I check it today, I can forward the other documents that I was not able, because if I get off of here, I don't want to lose you. So I was more worried about, because I'm not familiar with this format. So
do you think you'll keep this as a virtual simulation?
It's because you know what? We're in the waters now. We dipped into the virtual waters. Students want it. They like the, like I said, there's a power of the almighty phone. They can click into things. And that's what Turbulent Sky has. If I had my druthers, I would actually sign on for Sentinel U, because they have all of this embedded in there. They have a lot of community health, they have public health, they have peds, they have a lot of virtual stuff, but a lot of it they know is gamified. So that part of looking at that puzzle, the students got excited about that. It really kept their interest. So I definitely am going to keep this.
Thank you.
So any other questions that you can think of? Yeah, I think once we've gone there and we were pushed to do this, we can't go back now. To me, it's a standard. It's just what we do with it. So again, I used a moulage to kind of beef it up, because before in virtual, we didn't have moulage kits because we couldn't touch things. So I do that. And then I just buy stuff that's disposable that they can use. And I do Tegaderm. If you're going to put it in your skin, put Tegaderm down there, because I don't want anything to irritate, like makeup from like the local drugstore, But I actually have a trauma kit too. So, but I find it successful. I was amazed that it was successful, but you put the work in. But yeah, I don't think we're going to go back. I think we're definitely going to keep it until somebody says, Rose, face to face, I did a PowerPoint for an hour and a half, and then we did the simulation. We're still doing the same thing, but we're adding in the virtual part. And that to me that's the gift of this product, and it's free access.
That's great.
Any other questions? And I'm sorry, there's somebody else here that's on here. I didn't see you before. I apologize. You can unmute yourself. If you have any questions, feel free. Or ELLIOTT@holyfamily.edu. I can send those NLN. Now, the NLN put them out, too, so it wasn't a secret. And I got them off of the AACN digest, because we kept dumping everything in there, like, what do you need? What do you need? So I'm free to send them, because this isn't quarantine just for, listen to the word quarantine. It isn't just us. It's everybody helping each other out. That's what I found the big benefit from doing this. I look forward to finding more things to do. I wish they would just buy a product outright, and then I can run it like that. But, this works for now until I find something else. So I appreciate your time. I'm sorry I felt like I had to run through it, but I think Turbulent Sky, you just look and say, what does that mean, But
Thank you
again,
very
there's
much.
a lot of documents coming out now. The virtual simulations have changed. It has changed the format that we're going to be doing. But the in-person, is always always invaluable. So thank you for your time, and I'm going to close because
Thank
it's
you.
close to 12, and thank you for coming.